Should you stick with original Medicare or should you switch to Medicare Advantage? Let's look over the pros and cons of both options today. Welcome to Cameron Carter with Altruistic Insurance Advisors, helping you navigate Medicare with confidence. Now, what is Original Medicare? Original Medicare is your Medicare Parts A and B. This is your Original Medicare, ran by the federal government, the Centers of Medicare and Medicaid, CMS. Now, Original Medicare, as I just said, has two parts, Part A and Part B. Part A typically covers your hospitalization, skilled nursing, home health care, hospice, and some other great benefits. Now, Part B, this covers your doctors, durable med equipment, wheelchairs, walkers, canes, all of that type of stuff. Now, what is Medicare Advantage? Medicare Advantage is an all-in-one type of plan offered by a private insurance company such as United Healthcare, Humana, Aetna, Cigna, WellCare. Now, these plans combine your Part A, Part B, and sometimes your prescription drugs all into one plan, which makes up Part C, aka Medicare Advantage. Now let's do a comparison between Original Medicare and Medicare Advantage, and we'll see which one is the best option for you. Now let's talk about the cost structure of the two. Now with Original Medicare, Part A. Typically Part A is free to you by working your 10 years or paying what Medicare considers it, paying taxes for 40 quarters. Typically that's $0. Now Medicare Advantage, that's going to be the same. Part B in 2025, you're going to have a cost with that Original Medicare of $185 a month, as long as you've made $106,000 or less. Medicare Advantage is going to be the same because even on a Medicare Advantage plan, you still have to pay your Part B premium. Now, Part A and Part B, Original Medicare, both have deductibles that come with them. In 2025, that deductible for Part A is $1,672, and with Part B, you're going to have a deductible of $257 in 2025. Now, deductibles with Medicare Advantage plans vary by plan. Typically, they won't have a deductible on them. They'll be $0 when it comes to your medical deductibles. Now, let's talk about the co-insurance associated with Original Medicare and Medicare Advantage. On Original Medicare, you're going to pay 20% after you've met your Part A deductible and your Part B deductible. You'll have to start paying 20%. On Medicare Advantage, you have fixed co-payments or co-insurance amount. Now on the out-of-pocket max on Original Medicare, there is no out-of-pocket maximum. You can spend as much as you want. On Medicare Advantage, typically, all Medicare Advantage plans have a max out-of-pocket, meaning you can't ever spend more in the plan year than that set amount. Some plans may have a $4,000 max out-of-pocket, meaning if you paid $4,000, everything else in the plan is going to be free the remainder of that year. Now, that is the cost structure between Original Medicare and Medicare Advantage. Next, let's talk about the provider access and how Original Medicare and Medicare Advantage do on each. Now, with Original Medicare, you can go to any doctor in America that bills and accepts Medicare. On Medicare Advantage, these are either a HMO plan or a PPO plan, meaning you must go to these doctors and hospitals that carrier accepts and tells you this is who you can go see. Now, on Original Medicare, you're not going to need referrals to go to any specialist or doctors. On Medicare Advantage, when it comes to HMOs, you would need a referral to go to any specialist. Now on PPOs, most plans you do not need a referral to go to a specialist on a Medicare Advantage plan. Now you're probably saying, Cameron, that sounds great, but I do take a lot of prescriptions, so I am pretty interested in what is the difference of the prescription cost between Original Medicare and Medicare Advantage. I'm glad you're thinking that because that's what we're going to talk about next. Now, when it comes to prescription drugs, Original Medicare does not cover prescription drugs. You have to purchase a prescription drug plan separate in order to use prescription drugs with Original Medicare. Medicare Advantage is no different. On Medicare Advantage plans, typically most plans come with a prescription drug plan included on them already. Now, when it comes to pharmacies, with original Medicare, it varies by whatever prescription drug plan you're on. And on Medicare Advantage, it varies by whatever Medicare Advantage plan that you're currently on. Now, with drug co-payments, when it comes to original Medicare, this is going to vary by what prescription drug plan you're currently on. Now, on Medicare Advantage, you'll often have tiered levels to your prescriptions. Most of the time, you'll have $0 costs for most generics on a Medicare Advantage plan. Now, let's talk about the extra benefits that you get with original Medicare versus Medicare Advantage. With original Medicare, you're not going to get things such as dental, vision, hearing, over-the-counter, gym memberships, monthly food cards to use towards utilities, rent, transportation, things of that sort. Now, with Medicare Advantage, the federal government pays the private insurance companies money so that they're able to offer you things such as dental, vision, hearing, over-the-counter, gym memberships, food cards that you can use towards utilities and rent and things like that. So when it comes to extra benefits, Medicare Advantage is definitely going to be the winner, always. Now, to wrap everything up, who is original Medicare best for? Who is Medicare Advantage best for? If you want nationwide access and fewer restrictions, the best thing that's going to be for you is a Medigap plan, which is a Medicare supplement, along with your original Medicare. If you want lower monthly cost and an all-in-one solution, it's going to be Medicare Advantage. If you want flexibility and doctor freedom to go anywhere you please, it's going to be original Medicare. If you want something that's budget-friendly and comes with many extra benefits, you're going to want the Medicare Advantage plan. Now guys, let's go over the final thoughts. With original Medicare plus the Medigap plan, Medicare supplement, this is going to be better for people that are constantly in the hospital, have chronic conditions, and for people that travel often. Now the Medicare Advantage is going to be better for people that are cost-friendly and care about bundling all of their benefits into one. If you want an all-in-one solution for your healthcare, you're definitely going to want to lean more towards the Medicare Advantage side. Now guys, I'm glad that I was able to break down original Medicare versus Medicare Advantage and what's best for you. Hit that subscribe button, guys, and also just remember, if you are someone with questions regarding Medicare or any Medicare plan changes, give our office a call at 405-402-7727. You can also book an appointment with me or one of my great office staff members at our website down below as well. I look forward to speaking with you guys on the next video, and I hope you guys have a blessed rest of your week. I'll talk to you guys soon.